Hey, it's Maz here, and I thought I'd go through what to do if you have just experienced some back pain. So common question that I get asked on a regular basis. So I just thought that maybe I'll just give a few simple tips in terms of exercises, what to do as soon as back pain has been flared up. So a couple of things to kind of just keep in mind are any red flag symptoms. So if you have any first symptoms going down both legs, if you have any issues with any bladder bowel movements, anything in terms of loss in power, sensation, there's something that you would need to kind of be seen to by a medical professional. So please get in touch with your doctor, your local hospital, just to get that checked out if those symptoms are present. Once the back pain has been flared up, you will be limited in what you can do. So the most important thing is that we have to keep moving as best as we can. So just gentle movement, and a nice way to kind of overcome this would be to just start with some gentle isometric based movements. So all that means is you're not working through a big range of motion, your movement is limited, or you're not moving at all, but you're contracting the areas of the region. So for example, the muscles around the lower back, the legs, the hips, we are engaging in those muscles to kind of just keep them working essentially. Okay. So I'll give a quick demonstration. So we'll do a few different planes of motion. So first one is just find something in front of you. So this would be like a dining room table, a chair, something that's sturdy that can be supportive. All that you're going to do is you're going to place your hand in front, and then we're just going to focus in on a bending forward motion. So you're going to try and push down onto the object. So from here, all that you're going to do is you're going to try and fall forward. So your weight is trying to push down into the object, and then it's going to hold it there for a few seconds and then back off. Now this is going to be dependent on the level of pain, discomfort that you're in. So it might just be the case that you are not achieving any movement. It might just be you standing still and you are just contracting through the midsection here, the lower back, the legs, and you're trying to fold yourself forward, keeping your pain at a achievable level. Okay, so you don't want the pain to be too high, but something that's acceptable to you. So once you've done about a few seconds, back off, and then go again. Assess for repetitions. Maybe you consider somewhere between 3 to maybe 10 repetitions. I know that's very vague, but just kind of each person's different. So you just try and figure out what you can do at that point in time, and maybe 3 to 10 repetitions this way. You could then turn to the side, either place your forearm on the object, or you can place your hand, and all that you're going to try and do is you're going to try and bend sideways. So you're going to try and push down. And the same thing here, you're going to try and apply some pressure pressing down. And again, what should happen is you should feel tension running through this side here. Most likely there will be some pain with this as well. Okay. So again, just keep it to a measurable level, something that's achievable, and then back off. And again, you might want to maybe stack some items underneath you, books, bag, just so that it raises the level up, so you minimize any trunk range of motion. Okay. So once you've done that, you can turn around the other side, do the same there. What you can also do is just holding onto the underside of the table or something sturdy, and then you can try and extend back. So from here, you're just going to try and extend back, hold for a few seconds, relax, and say it again. So start off with those gentle kind of movements initially. See how you respond to that, and as time goes on, you can then start to increase the contractions and the repetitions, and also you can experiment with the range of motion. As time goes on, Back pain has a favourable outcome, so your symptoms will start to ease up, you will get more movement, your pain will subside. This is dependent on each individual. You will have to modify your activities for the time being, which is unfortunate, but it is something that's going to be needed. And again, just reflect your exercises to match what you can kind of tolerate at the moment, and just keep moving.